Hello everyone, I am Dr. Lieutenant Colonel Abhishek Purkayastha. I am working as a consultant radiation oncologist in Onco-Life Cancer Center, Satara, Maharashtra. Today I will be discussing in brief about a phenomenon or a syndrome called radiation fibrosis syndrome. Before coming to the main topic, I'll just want to share some day-to-day activities or interaction with patients. Whenever a patient comes to me in my clinic before starting radiation, most of them will ask, "Doctor, what are the side effects of radiation?" So, as we see, a coin has both sides. So, in our case, radiation, apart from its beneficial effect, also have some side effect. Because as we know, even a tablet of paracetamol has their own side effects. So my topic is based on this effect of radiation. So what is radiation fibrosis syndrome? Radiation fibrosis syndrome is a progressive fibrotic tissue sclerosis together with various clinical symptoms in the irradiation or the radiation field. Actually, it's a late finding of radiation therapy and may be seen weeks or even after the treatment. Many of the systems such as our musculoskeletal system, neural tissue and even cardiopulmonary systems may be affected. Radiation fibrosis syndrome is a serious disorder. Nevertheless, when identified early, rehabilitation can be done. Genetic factors often play a significant role in the development of this chronic fibrotic response to radiation injury. As we all know, cancer patients are treated with external beam radiation therapy. Surgery and chemotherapy as such causes damage to the tissues. And when it is added with radiation, it causes an additive effect on the body tissues. Radiation causes damage not only in the tumor cells, but it also causes damage to the nearby normal tissues, which are within the planned radiation field. This adverse effect of healthy tissues by ionizing radiation is largely influenced by the radiosensitivity of individual cells. The majority of the late effects of radiation vary in severity depending on the radiation dose, the fraction size and the volume which we treat. So at this point, I want to inform you that radiation fibrosis syndrome has been seen mainly in the 2D era. 2D era when radiation therapy was given by two-dimensional radiotherapy technique. However, radiation therapy or the radiation field has graduated from the 2D era to now to 3D CRT era, and the more conformal radiation therapy techniques like the intensity modulated radiotherapy, image guided radiotherapy, volumetric arc modulated therapy, that's the VMAT, and stereotactic radiosurgery or stereotactic body radiotherapy. All these techniques, the highly conformal techniques, have played a very crucial role in reducing this side effect of radiation fibrosis syndrome. Radiation fibrosis syndrome can be acute, it can be chronic, and it can be delayed. Acute side effects include mucositis, dysphagia, dermatitis, and blackening of the skin, which occur after 2 weeks in 2D or 3D CRT techniques. However, these changes occur very late when patients are treated with IMRT or IGRT technique. It generally appears 4th week onwards. Radiation fibrosis syndrome may occur in the skin, the subcutaneous tissue, the pulmonary system, the gastrointestinal and the genitourinary tracts, as well as any other organs within the radiation field. Radiation injury causes or triggers inflammation and ultimately stimulates the production of myofibroblasts from undifferentiated fibroblasts, which in turn produce excess of collagen and different constituents of extracellular matrix, which are aided by a reduced secretion of remodeling enzymes. Subsequent fibrosis reduces tissue compliance, and in a majority of cancer patients, particularly those with head and neck cancer, causes cosmetic and functional impairment that significantly impacts the quality of life of the patient. A quality of life is a very important factor in radiation therapy or in a cancer therapy. As I mentioned earlier, a higher dose and a higher dose fraction, as in a hyperfractionated radiation, during palliative settings, larger volume of tissue irradiated, a larger radiation field, inhomogeneity of dose delivery, and prolonged therapy, which is seen in frequent treatment breaks. The effects of radiation are additive, and patients with history of re-irradiation or recurrences at the same primary site are known to develop severe fibrosis. Radiation fibrosis syndrome is generally a late complication which may either not manifest clinically for years after treatment, which is known as the delayed radiation fibrosis syndrome, or it may appear within a year of chronic RFS, and even during treatment in few cases as acute radiation fibrosis syndrome. Radiation fibrosis syndrome causes both functional and cosmetic impairment and may cause morbidity and sometimes mortality. Chronic manifestations include trismus, that is difficulty in opening of mouth, xerostomia, that is drying of mouth, reduced voice quality, skin thickening or induration, osteoradionecrosis, difficulty in swallowing, and even aspiration. There can be muscle atrophy, there will be soft tissue edema, there can be lymphedema, there can be restricted joint mobility, there can be mucosal thickening, ulceration, fistula, and even stenosis of hollow organs. Lung and breast carcinomas were present with interstitial fibrosis, dyspnea, brachial plexopathy. Osteoporosis and osteopenia are the delayed complications of radiation fibrosis syndrome, leading to pathological fractures of weight-bearing bones. The management of this syndrome is a complex process comprising of medications like combination of pentoxifylline, tocotrienol, and steroids. However, there has been no definitive cure for this chronic sequelae of radiation. Education, physical therapy, rehabilitation, and occupational therapy play an important part in the management of this radiation fibrosis syndrome. I would like to emphasize to everybody, if ever you have to take radiation for any cancer, always choose the highly conformal radiation technique like IMRT and IGRT, because IMRT and IGRT have resulted in very less incidence of radiation fibrosis syndrome. Thank you so much.